Greetings guys, Mark Boswell, Boswell Emergency Medical Education. Going to do a little video short segment for you, talk about the values and the benefits of CEN certification. Of course, this is something that probably a lot of people have already been considering and looking into the options and what's in it for them and trying to decide if it's right for you or not, or if this is something you'd like to pursue as part of your ongoing education and development. So we'll talk about some things. Let's start talking about the benefits of CEN certification, okay? I'm going to put these in a couple categories. The first one, let's put into tangible benefits, the things that, I'm going to call these like the things you take home, the things that really matter to you, that really like hit you in a tangible, real way. Of course, one of the big things will be monetary, okay? Many different hospitals, facilities are going to offer some type of hourly raise, maybe a quarterly bonus, maybe an annual bonus. So there's going to be a monetary gain for the most part. Now, unfortunately, not all facilities do that, but it is the majority of them. There's something monetary that can be gained from this, from your employer. So for a lot of people, that's one of the real tangible benefits for their certification. And again, it could be an hourly raise, it could be an annual stipend, it could be part of a clinical ladder as well too. CEUs and continuing education contact hours. This could be a tangible benefit. One way an employer helps to support certification may be, and I've seen this done at several hospitals, that they provide either the money or the opportunities for the nurses to get their ongoing continuing education required to maintain that certification. And even if, and those same hours as well will also benefits you as far as your nursing license if you're in a state that requires continuing education hours for that as well. So that could be a real solid benefit as well too, which actually helps to defray your cost down the lines as far as renewing. Some hospitals will even pay your renewal fees if you're certified. So it really varies from employer to employer. You know, the most important thing is to talk to your employer, your human resources, or your nursing leadership to see what benefits financially being certified benefits you, because it's going to change from place to place. But I would say overall, most facilities offer some type of financial incentive to achieve your certification. Job benefits. There's several reasons here. It could be a promotion for you. It could help you go up on your clinical ladder. It could provide you a step in your grade, like going from a registered nurse level 1 to a level 2. It could be part of an overall recognition program. Unfortunately, it may also be a requirement for your job. I've seen that in a few places also. You know, I'm kind of torn on that. I think there is a role for certification in clinical practice and as well as a leadership role. I hate to see people get mandated to get certified with, you know, either short notice or being told they have to give up their position if they don't achieve it. I think I would rather see it as something, if they wanted to move up, they should be required for that next step. But rather, I'm not a big fan of having people lose their position because they're not certified. And so those are some of the job requirements that may mandate it as well too. There may be an employer mandate to have so many certified nurses as part of their working pool, with a bigger push for hospital accreditation and certification of their staff. You may see this in some places also, so it may not really be a free will choice that you as the individual nurse gets to make. The values of certification, so these are a little more intangible things as far as to the individual nurse. These are things that are a little more nebulous or harder to describe, but they still have a real importance. One of the values of certification to the public is it does indicate a higher level of care. Now, you know, arguments aside, we've all heard of that person who is a really good nurse but can't pass the certification, but their nursing skills are still, you know, high level of excellence. And I get that, but the public doesn't know that. The public doesn't get a chance to talk to the nurses when they come in and say, hey, how many years have you been on the job? How long have you been doing this? What's your experience level? What's your education level? Things like that. You know, we do have it on our badges sometimes, whether you're a BS, an ADN, or an MSN. But let's face it, the public just needs nurses to care. But when we can promote that our staff has a level of certification, or a large number of our staff is certified, there actually is a public benefit. There have been reliable studies that have shown a higher level of certified staff does promote better patient care. Less adverse outcomes, less safety events, things like that. So patient care definitely improves with the promotion and the achievement of more staff being certified. Institutional wise, this benefits the institution several ways. I'll get to a few of them as a separate bullet point here in a minute, but probably one of the big ones is institutional recognition. And I understand that it seems like it's just another merit badge to hang on the wall of the department. I understand that. But let's face it, from a marketing standpoint, and we need to understand that healthcare is a business that does have to be marketed and promoted. If the patients don't come in, we don't have jobs. If the patients don't get admitted, the hospital doesn't have the same financial status that it should. And we do need to be stewards of the employer we work for to encourage or enhance their fiscal robustness, if you will. So with certification of the staff, this enhances the quality of care that's being given, which then can also be used as a marketing situation for the employer as well too. And let's face it, given the choice between two hospitals, if you saw two billboards and you saw one that said Hospital ABC had 100% of their staff certified as emergency nurses, and you knew that Hospital XYZ had no certification, where would you rather go? I mean, let's face it, being certified is a step up as far as demonstrating your cognitive and nursing practice. All right. So these are some of the benefits also to the facility. Another big one as far as to the department is employee retention, job satisfaction. It has been shown, and I'll lead right into the ANCC magnet status in just a moment, but it has been shown that a facility that supports certification does enjoy a higher retention of nurses, and it does enjoy a higher nurse satisfaction as far as their job goes. So this is a benefit for management to encourage the certification for their staff, because there's something that happens when you start promoting this and it becomes a desirable goal for the staff as well as the department. And typically the processes that have to be put in place to encourage this, they're going to be akin or in line with other worksite improvements or worksite satisfaction enhancers, if you will. So it definitely plays a benefit to the department as well too. Excuse me. Of course, accreditation, the big push these days is ANCC magnet status. It's not that the magnet status pays off for the hospital financially, like more money, but what it does do for the hospital is, and I can say this with having worked with a large academic center that pursued the magnet status, to achieve magnet recognition, there are processes and things that have to be put in place to meet the recognition guidelines. And these processes, recognitions, are for the most part nursing focused. They're focused on improving the work environment, improving the practice of nursing, improving the clinical environment for nurses, improving the leadership that's given to nurses. One of the tenets of magnet certification is to demonstrate how the facility supports or encourages specialty nurse certification. So of course, for emergency nurses, that would be the CEN. And it's just one more marker that shows how a hospital that is applying for magnet designation is going to be doing some processes that benefit the nursing staff. Magnet hospitals have been shown to have a lower turnover, less absenteeism, less errors, just to name a few. This has been shown because it's an overall system improvement with a focus on the nurses. So supporting certification is one of those ANCC magnet criteria. And value to the nurse, this becomes a very personal decision or commitment or calling, if you will. A lot of it comes from more of an internal locus of control, not so much about, well, I'm just there for my 12 hours, but you feel more engaged with your work site, and it almost becomes the next level of progression to professionally advance yourself. It's one thing to go and just punch a clock for your 8, 10, or 12-hour shift. It's another thing when you start to get engaged beyond those shift hours. You start to become more of the process. You start to see yourself as a stakeholder. And a lot of times that spills over to your professional development as well too, that you know there's just a higher calling. It's not as common in younger, less experienced nurses because there's still, if you follow that, I believe it's Benner, that novice to expert model, the novice nurses, whether it be novice in their career or their experience or just even their age, there's more of a external control to their behaviors and their practice. As you progress through that experience, more to that expert stage, you start to have more of an internal drive. You start to internalize and your actions become part of what you hope to achieve or move on, whether it be professional leadership goals, whether it be recognition, whether it be personal satisfaction. But yeah, I don't have the numbers or the statistics, but my assumption and what I've seen from all the classes I've done is typically it's the nurses who have been in this business for a few years at least. You typically don't see new grads or those in their first, second, or third year stepping up for this. I'm going to say the average is more nurses have been closer to an 8 or 10 year mark where they feel that professional calling or that urge to move themselves on and to better their professional career. Barriers to certification, I figured I'd throw this in there also, even though the topic is going to be value and benefit. Let me throw the barriers up. I think most people know this, and I think this becomes more the stumbling block for most people why they don't pursue certification, because the barriers carry more weight for them than the values and the benefits do. And once those two equalize out, then I think a person is more likely to pursue certification. So if we, as educators, myself, consultants, as a nursing professional development network, continue to help negate these barriers, I think we can see more nurses shift towards seeking certification. So of course, a big one is time. You know, it's an intimidating exam. It is a professional, national, board level exam. The perception is it's going to take you time to prepare for this and get ready. Now, that's not always true. There are many methods and tools out there to assess yourself and see if you're ready to take the test. And if you're more ready than you think you are, time may not be a big commitment. So I would stress to any nurse considering this to assess themselves with one of these validated tools or assessment exams and see just how close they are to being ready, because the time required to study may not be as much as they think is actually necessary. Financial, of course, is another barrier. Of course, costs. You know, and it's a big upfront cost. Without your ENA discount, it's a little over $300. And of course, to renew, it's a little less than $300. And, you know, to nurses, that's a big chunk of money. But, you know, and I tell people in class, especially that renewal fee, that's every 4 years. So if you even take, I'm just going to say an average of $300 divided by 4 years, that's only, what, a little between about $75 a year to put aside. Okay, so that's maybe, what, $6 a month out of your monthly take-home pay. $3 out of your biweekly check to set aside, and in 4 years you'll have that paid for. So, you know, I see that as a barrier, and it's the upfront cost when you got to cut that one check for $300+ to take the test. You know, hopefully that's something that your employer will support to help defray that cost for you, but it's understandable. And of course, you got the time of study, going to classes, getting books, materials, things like that. So that can be a barrier also. But I think if you look in the big run, even the most popular hourly raise I've seen or heard talking and networking with people is usually about $1 an hour. So if you look at the bigger scheme of things, the average full-time person works about 1,200 hours a year. $1 an hour for a year, that's $1,200 a year. That is already paid for your renew cycle. It's paid you back for whatever you spent to take the test. And the next 3 years, that $1,200 is money in your pocket. So it's there. It's definitely not unachievable, but it does require some planning, some budgeting. Personal barriers. I think one of the big things is just intimidation. It's what kept me from taking this test for so long, because I thought, hey, it's a national board exam. You got to get a 90% or better to pass it. That's not true. All right. Currently, you need a score in about the 70s. I'm not going to specifically say a number because it changes with each test cycle a little bit, but it's been in the 70% is what you need to pass this test. And that's doable. We all did that in nursing school. We had to get at least a C or better to pass our classes. So concern about, you know, how hard it is or how difficult. But again, you can knock that barrier down by doing some self-assessments and just seeing where you're at. Okay. Another personal barrier may be things like intimidation, test anxiety, flashback PTSD fears from nursing school, and those nursing instructors who just grilled us like the old nuns in the Catholic schools or whatever. Those test fears. Yeah, I get that, but this is not that same scenario. This is a national board exam type situation. Don't think about those tests you took weekly or biweekly in nursing school. think about how the NCLEX was. This is similar to that, okay? You didn't have some instructor lording over you with a ruler and berating you and having to argue with you till you're blue in the face about the rightness or wrongness of an answer. This is a validated, authoritative exam. Okay, so those fears about nursing school, throw those aside. This is not some nursing test your instructor made up the weekend before the test was due. Okay. Other stuff, test anxiety. There's ways to deal with that, even if it's a matter of talking to your primary care doctor and maybe you need a mild anxiety medicine for a day or two before the exam. There's study strategies for people to test anxiety. There's test-taking strategies for people to test anxiety. Okay, now, a lot of people say, oh, I have test anxiety. I'm talking true panic level PTSD, sitting there at the desk, sweaty palms, heart rate over 100, chest pain, hyperventilating, cannot focus, test anxiety. Okay, that's panic mode. Every one of us has some degree of stress going into a national exam. I do. I've taken this, 6 or 7 times. It's still stressful. It's just how do you manage that stress? And there's ways to deal with that. So I think these barriers, and I think that's good for someone contemplating this journey, is to acknowledge what their barriers are, financial, personal, time, commitments, etc. Analyze your barriers and address them. Are they valid, real barriers? Are they just things you're spending too much time worrying about? Are they just your body's unconscious way of delaying this? Your unconscious mind trying to take advantage of you, say, no, don't worry about that. It's too hard, costs too much, you won't do well, things like that. So we need to identify those barriers and break them down. And as an education community, we can do that as well too. So one of the things about the classes I enjoy is talking about these things a little bit, not a lot in class because we're there more to do the actual review. But talking about things to demystify this exam, things about to decrease the stress levels, people's perceptions of it, things like that. So hopefully that helps. So I'm gonna wrap it up. So that was, it was supposed to be just about values and benefits. And we talked about several things. We talked about the values, obviously money, financial, talk about job progression, career growth, job requirements maybe. We talked about benefits to the patient, benefits to your staff, benefits to your institution. And also then I talked about some of the barriers to certification. So I hope you find this useful. Share it with your friends. I've got my information down there on the bottom left, and I'm gonna put it in the comments or the header of the video as well too. Contact me if you need to. There's other resources on my website, link to the Facebook page. There's lots of other videos there talking about exam prep and exam information, things like that. And reach out. I do return all emails personally. You don't have to go through an assistant or anybody. And I'm here for you. I mean, it's my passion to help these things happen for people. It's a gift I've been given to be able to teach about the CEN exam, and I do it well. And so I don't do any other exam prep classes. One of my mentors told me to pick one thing, do it as good as you can. So my life is CEN focused, and I'm here for you guys. So shoot me an email, shoot me a text. I'd love to hear from y'all. Let me know if this was helpful. And if you go on a test, let me know how you did. I like to recognize people that are successful. Maybe I'll see you in a class. Maybe we'll just talk on Facebook. All right? But y'all be safe. Have a great day. Keep in touch.